what is a knee replacement? There's different types of knee replacement, but in general, a knee replacement is probably a misnomer. A lot of people think that for a knee replacement, you cut the bones here, and then you just put a hinge in. It is not far from the truth back in the early 1960s, but they discovered that this will fail quickly. So then the development came to actually a resurfacing. So what we do, and this is what a knee replacement will look like in this bony model, and what we do is we shave the end side of the bone to match the back side of the component to resurface the area that represent the cartilage. So that would happen in the lower end of your thigh bone. But on your tibia bone, which is the leg bone at the top, we cut it flat to match the lower end of this tibial component, and then we put a keel to anchor it so it resists some of the stresses that happens. And between the two metals, there is a plastic sandwich that act as the cartilage and to act as a cushioning device. So in reality, every knee replacement is not really a replacement, it is a resurfacing. And these are the three of the four components that constitute the knee replacement: the femoral side or the thigh bone, the tibial side, and then the plastic, which represent the cartilage. This is almost always made out of cobalt chrome. This is almost always on the tibial side is made out of titanium, and this is made out of high-end, low-wearing plastic. Another component that is not present in this model is the backside of the kneecap. The kneecap bone is incredibly important for the function of the knee. So it acts as a lever arm to help double up your strength to work with your quad muscle. So in it, the majority of it is your own bone, and the backside of the bone is shaved flat to accept a plastic dome that we cement on the backside of it so it articulates with this metal. So yes, 2 metal pieces and 2 plastic pieces that constitute the knee replacement.